Are there surgeries for migraines? We have a question here from Sarah, and it was based on one of the other videos that we made, which was talking about trigeminal neuralgia, which is facial pain, and some of the surgical options that people may take, and then of course some of the other less invasive options that they can have as well. And what she's asked here is, what about severe migraines or headaches for days? And then kind of explain some more about the symptoms she's having. So to my understanding, at least, is asking if surgery is an option for migraines and headaches. And it's something where it can happen, but to be honest, it's not something that happens very regularly unless it's very specific causes, and it's not usually as recommended by doctors. So there are some very specific causes which your doctor may recommend surgery for migraines or headaches, such as something very extreme, like say a growth or a tumor, something that they suspect may be directly causing pressure onto the nerves, the blood vessels in the area, or if there's something else that's maybe happening in those surrounding tissues. However, as we can see here from the American Headache Society, they actually do not recommend migraine surgery, again, unless there are very specific reasons or causes. The reason for this is very simple, because there just is, unfortunately, is not enough research to say if these surgeries would usually be required for these kinds of cases, and because there's a lot of other less invasive, less risky, much safer options for headaches and migraines. But for the purpose of the video, let's dig into some of the different types of surgeries that people do have for headaches and migraines for very specific cases. So the first one we have here is called peripheral neurolysis, and essentially it's kind of similar to some of the surgeries that were happening for trigeminal neuralgia. It's where a small piece of tissue that's in the body may be compressing more on the nerve, and that's what's causing some of the symptoms for that person. So with this surgery, essentially they're going to be making an incision, cutting out some of the tissue around it, and then they're actually going to add fat into the area, which is going to act like a bit of a cushion, a bit of a buffer, so that it won't have that pressure on the nerve again in the future. Next, we have neuromodulation. This is going to be using electromagnetic waves, stimulating certain parts of the brain to try and essentially disrupt some of the messages that are being sent out, which may be causing headaches. And it may look a bit crazy and a bit science fiction here, but it's not actually as scary as it looks. However, it is something which doesn't have as much of a strong research background for it, and it can be used then for other uses. So something similar to this can also be used for something like, say, depression or for changes in behavior. But again, the research is not quite as strong when it comes to using these kinds of electromagnetic waves. This is one way which is definitely less invasive, as it's not going to be making any kinds of incisions and it uses a much smaller device. However, it's something which doctors do say may not be for everyone, may not be as helpful for everyone, or some people may not like the sensations that it produces. Next up, we have septoplasty. This is going to be for a deviated septum, so that's that part in the middle part of your nose, and it's going to be suggested when needed by an ENT. Next, we have turbinectomy. So you see these things here, these kind of reddish looking pouches. These are what we call turbinates, and you find them inside of the nose, and they help to warm and sort of wash off some of the air as it's coming in through the nose. However, if they grow too big, then in some cases this can be something that leads to headaches. Or it should be noted that for this kind of headaches, it's usually much more associated with sinus headaches rather than tension headaches or migraines or other forms of headache. So while there are some surgical options, it must be noted that they're only in very specific cases. They would not be for any kind of headaches or migraines as some sort of quick fix. And with all of them, of course, like any surgery, they will carry some level of risk. The last two I mentioned, the septoplasty and the turbinectomy, two common side effects of this would be loss of smell and loss in taste, just due to the nature of where that surgery will happen. And same for this surgery, any kind of surgeries, even for the ones which are using electromagnetic waves, which are less invasive, there can potentially be side effects, such as affecting other parts of the brain, or maybe if they are using electrodes, then maybe they come out of place and start to not become as effective over time. So while these surgeries can be an option in certain specific particular cases, for most they would not be advisable, and most neurologists would not recommend going for surgery, again, unless there was something very physical and organic, such as a growth, a tumor, something happening in the sinuses or in the turbinates. So for most cases instead, it's better to go for something much more conservative. And if you go to see your neurologist, it's very common that they're going to maybe give you some pain medication, maybe they're going to look at, say, some functional management, maybe they'll look at trying reducing the triggers and start with that conservative approach. But unfortunately, this isn't helpful for everyone, and for some people it may only be helpful in the shorter term. When things become much more chronic, this is where it becomes less effective in terms of the medication and the lifestyle modifications. Suddenly the medication needs to be stronger and the modifications of lifestyle need to be more extreme. I've been in practice for more than 10 years, and we see lots of cases of headaches and migraines here in the practice. And one common thing that we do see, particularly when someone has already been to see their neurologist, the ENT, and everything's been cleared, maybe like this patient, they've had MRIs and everything has come back okay, then it may be an underlying issue in the nervous system which is contributing to the problem, particularly something happening at the top part of the neck, because the nerves from this area supply what we call the cranial nerves, which are the ones that supply all the information to all parts of your head. So if there's a problem at that area, it's kind of like someone damaging the wires that would be going into your house for electricity. It's not a problem with the TV, it's not a problem with the light switch, it's a problem with the power that's coming in the first place. If something happens at this level, it can affect things all around here, which can affect things like headaches, migraines, or some other symptoms, whether it's neck issues, pain into the face, or maybe even starting to affect things like your hearing or your balance. And in my years of experience, I found that upper cervical care was the most effective way that I could find to work with headaches and migraines, because it addresses that area directly at the source. And we use nerve scans at every appointment to make sure that we are tracking things objectively to see what's happening in the body, not just following the symptoms, even though that's also very important, and also taking a specialized type of x-rays to see exactly what's going on in that area, whether it's safe to do any kind of appointments and adjustments, and how we should be adjusting for each individual person's anatomy. If you have any other questions about headaches, migraines, different types of surgeries, or how we can help with upper cervical care, drop them down in the comments or send me a DM. And if we're not able to help you because we're too far, we are based in Singapore, then I'll do my best to advise who can help you in your area so that you can get better relief from headaches and migraines as soon as possible.